Welcome to PT Chit Chat. What's up, Nico? Episode 6.
What's going on, Payment? Welcome back, everybody.
Welcome back, guys. Episode 6. I know we're 2 weeks out from the last one, but
Life happened, you know.
life happens, man. But here we are. And let's start things off with the question from Gloria from Ireland.
From Ireland?
Ireland, yeah.
Oh, man, we're international now.
That's right. Now let's see what she asked. So Gloria wants to know, Nico. What? So first of all, common sport injuries that we see in the clinic. She's a first-year student from a sport rehab in Ireland.
Okay.
Common sport injuries, and as a PT, how do you check your sources when you want to, look stuff up?
Well, what does she want to know about sports injuries?
Oh, just common ones we see in
Okay.
overall, and it looks like she wants to know about different levels of education in Canada. So Canada physiotherapy is a master's degree. So that's you come out of undergrad 4 years, you do whatever you want, do the prereqs, pretty much, and then you go to physio. And if you get in, it's a solid 2 years from there. And
And then in the U.S., it's a doctorate. So
yep, you do 4 years or whatever, and then go 3 years of doctorate, right?
3 years doctorate.
Yeah. But common sport injuries. So
So we have like ankle sprains.
yeah, I see that a lot. I see that a lot.
Yeah, jumper's knee, tendinopathy.
The
things like that.
shoulder, especially like in throwing athletes, you have the shoulder issues. Ankle sprain, soccer players immediately jump up to me. I treat a couple soccer players that were younger, actually, like 17, 18-year-olds that had like full tears, actually, that got better, believe it or not. Oh, I wouldn't say full, like close to full, you know what I mean?
Sure. Well, okay, let's make this a little bit more educational, Payment. So why is it important to like know anatomy? So let's talk about an ankle sprain, right? So
I hate you. You know I hate anatomy.
I know. Well, let's talk about like a common like an ATFL ligament, right?
Yeah.
That's in the ankle. So that's a lateral ankle sprain. Why is knowing anatomy important? So
let's look at the attachment and the attachment
Sure.
points. ATFL, talofibular, talus to
Talus
fibula.
and the fib.
Whoa, right? Anterior meaning anterior, right? Hard anatomy right there. But so on a lateral ankle sprain, like if your foot's planted, right, and then you go to sprain it, if it doesn't tear, right? If it doesn't tear, I learned this from my clinical instructor, actually, which is why it's so important to listen to them, because they're actually really smart. If you don't get a tear, you get a slight anterior translation, forward translation of the fibula. So someone comes with an ankle sprain. A good mob that I like to use is a posterior distal fibular glide, right?
That's right.
And having said that, now that you know it may translate anteriorly distally, well, it's got a proximal attachment, right, at the top. So
if it moves somewhere, it's gonna move the other way.
guess what? It's going to be a posterior translation at the top. So doing an anterior move of the proximal fibula can also kind of help accelerate healing.
Yeah, I mean, and this is why people are like, oh, like you guys can't treat a sprain. You just gotta let it heal. Well, no. There are things that we can do to help accelerate it. Sure, you need the time to rest and all that good stuff. But like I said, there's techniques that we can use to
Dude, I'm gonna cut you off because I had so many people that come into me like 4 months later and they're like, man, my ankle hurts or is stiff or I don't have the same motion. I had one the other day and I was like, oh, okay, so when was like your wait, why does my name just say Payment Chem? Am I like demoted from PT? Anyways. I was like, and then they go, 4 months ago, and I was like, why are you in now, first of all? She's like, oh, or he's like, oh, well, you know what, my doctor just said to rest, or if so-and-so just said rest, and I felt okay, and etc. And I was like, so you want me to fix your emotion after 4 months is what you're telling me? And I'm like, come on, guys.
You have to get in early, guys. Get in early. And for your physical therapists up there, please just don't do a hodgepodge of treatment and just kind of throw everything in there. Think about it. Use anatomy, kind of think of what's going on, and what's missing and what's a
Dude,
fix.
on Reddit, so I'm on Reddit a lot for physio. Sorry,
Okay.
Gloria. Andrew, we'll get back to your question. I was on Reddit, and Reddit firmly believes the only thing that helps patients is exercise. They literally discredit manual therapy. They discredit electrical stimulation. They discredit anything but exercise, because the only thing on studies that say that, has a high, like, you know findings for
Uh-huh.
improvement is exercise. I think they forgot to talk about tissue healing and how it takes time for tissues to heal.
That's right.
They must
That's
have
right.
forgotten. So if somebody comes in there in pain, you're just literally giving them shoulder pain and they're just doing shoulder exercises all day and you expect them to heal. That's not going to work.
Yeah. And it's probably like those extreme physiotherapists that believe like one treatment method is the correct way and everything else is wrong.
Yeah.
Like you keep an open mind.
Be an artist of your profession. Anyways,
Ooh, artist of your profession.
next.
That's why you don't get your information from Reddit, Payman.
I just love being on there and listening and reading stuff, and sometimes maybe butting heads with some people.
Oh,
So
didn't she ask where?
yeah, where do we get our information from? You're right. So she wants to know. I personally, okay, couple things. I take courses from like credited sources. So if you go
Uh-huh.
online and you search and look at reviews and etc., there's a lot of doctors of physiotherapies, right? That have information that you can learn. That's
Sure.
from, and their information is actually collected from articles. So in my courses, I'll like watch a video with them and then I'll go and read the articles that are given to me. So it's a direct, I got to go read an article. So I personally look at Pubmed, to be honest with
Mm-hmm.
you.
Look at
Um,
meta-analysis.
Pretty much. And like tennis elbow, the Therabar
Yeah.
that's used for tennis elbow, lateral
Mm-hmm.
epicondylitis. There's a
Yep.
study on that, right? There's
The,
a
the
whole
thing that
study.
the thing that
Yeah,
twists.
yeah, yeah. There's a whole study on that, on why it's effective.
Yeah.
So, when I look at different conditions, like let's say I don't know how to treat, I don't know, let's just pick jumper's knee. I'll go look at the current evidence in jumper's knee and kind of look at what they went through and what was working for them, right?
Mm-hmm.
Doesn't necessarily mean that's going to work on my patient, but it's just like a good
It
idea
gives
of
gives
like,
you a good
yeah.
idea. And I'll be honest with you, back when I was in school, I hated research class. Oh my gosh, I'm telling you, I hated it with all my guts. But then I realized, like, after practicing, like, I'm constantly looking up at what the research is saying for different things.
And honestly, that's what I hate about our profession. It's like what I hate and love. It's like if I sat down today and actually started learning every possible thing in this profession, I probably still wouldn't
Possible.
finish by the time I was dead, to be honest
Yeah,
with you.
I know it's impossible.
Assuming I live 100 years, that is. But I still wouldn't finish. But yeah, so PubMed articles usually.
Yeah,
Not so much PT journals. I'm not really subscribed to PT journals.
neither am I. But they do have some good information in the PT journals. I also go and look back at my notes from school because they always have good information, especially if I'm trying
Yeah,
to
like
just
if I
get something real
forget how to do a
quick.
mobilization technique, we got some
Sure.
videos that we can certainly refer to. And alternatively speaking, I know YouTube's not the best source, but there are some good clinicians on YouTube that show different mobilization techniques that you haven't even done before. So,
Yeah.
anyways, you can always learn stuff there.
Just make sure, like, when you are looking at YouTube or just internet sources, make sure they're qualified individuals. Make sure they're physical therapists to begin with. um yeah, and just make sure they're qualified.
The nice thing is once you start working, you kind of get to pick out and see if this makes sense and if this doesn't make sense or what's going on with that.
Mm-hmm.
So,
Mm-hmm.
so you'd be
and
all
al-
right.
and also colleagues, of course. We always have a group chat going on with me and a bunch of colleagues. Whenever we have a tough case, we're always discussing, like, hey, what would you do in this situation? um you know and we just kind of get ideas from there and we talk about it. So use your classmates, use your colleagues. They've always got some good information.
And last bit of advice: not everything is textbook. Okay.
That's true.
You're gonna get some scenarios where unfortunately it just doesn't make sense, and sometimes you talk to them and they feel better. Okay. Anyways, so topic of the day, hopefully that answered everything you wanted, Gloria. If not, we'll keep in touch. All right, so
Thanks for tuning in. all the way from Ireland. That's awesome.
That's right. That is pretty cool. So, topic of the day. What is our topic of the day, Nico?
Oh man, I think we were gonna kind of talk about getting that job. Talk about interviews, talk about productivity, talk about loan repayment, just that first step. You just graduated. What now?
You got that sweet diploma.
Yeah,
You got that sweet
worth
degree, I should say. I should say.
worth thousands of dollars. Now what?
You got that. It's funny you said thousands of dollars, right? So I was when I had to photocopy my degree, the
Uh-huh.
guy was so careful. He's like, "Man, this thing's worth hundreds of
I know, right?
And I was like, "What do you mean?" He goes, "You know what I mean."
Oh, it's really
All right,
like
so
that.
you're out of school. You're pretty much
Uh-huh.
excited, right? You're excited that you finished. You passed that sweet license exam, hopefully. Um,
Congratulations.
and you got probably loans, or if you got good parents that are really rich, um, whatever. You got something to pay off. And how do we go to do that? We need a job, right?
Yeah,
How
we
do
need
we
a
nail
job.
that first job? What should we do, Nico? I think one thing you can do, honestly, is for those that are obviously in the States that went to school in the States, even Canadians, during clinicals, sometimes they're hiring, right?
Absolutely.
Yeah.
Absolutely. Always think of every interaction as a job interview, even when you're a student. But from my experience at Payment, it's a little bit different because I'm a traveler. So I guess we'll talk about your experience because you had to go actually look for a job and do all that stuff. So what was your process? You graduated.
So obviously I didn't work in the States because I just left.
Right. Right. But let's say you got all your Canadian stuff completed. What did you do? How did you find that job?
I literally went on Indeed. Do you guys have Indeed there? Do you guys
Yes,
have
we
what?
have. Yes,
Oh,
we have
oh
Indeed.
you do? Okay. I wasn't sure. I literally went on Indeed.
Uh-huh.
Um, I'm not being arrogant or cocky or anything. I submitted 2 job applications. The first one got back to me and I just took it. I kid you not. I mean, did I do
Did
some
you end
research
up
on it? Yeah, it
did
was a
you end
brand
up
new. Go
did
ahead.
you end up liking the job?
Oh, I quit
Still
like 3
working
months
there?
later.
Okay,
But
okay. So this is why, guys. This is why you don't just take the first job that you
but
see.
or no, you do take no, I disagree. See, I disagree. I
Oh,
think you
okay.
take the first job that's in front of you. You get in there, you get your feet wet, and then you start to, like for example, it was a up and coming clinic. So I was the lead PT coming out of school. What the heck, right? And then, there's no one that I can refer to for information, right?
Mm-hmm.
So guess what I was doing? Spending time Googling, researching information. And doing that helped me quickly accelerate my knowledge. If I had someone to constantly refer to, I was too comfortable, right?
Yeah.
Anyways, that's my train of thought. I think the first job you just need to get in
No
to
matter what it
actually.
is.
I mean, listen, like to a degree, right? Don't work some sketchy companies or people, but like get in, get your feet wet, start using those. Because my opinion is, the longer you're out of school, the less confident you're going to be once you get into a job.
Okay. Okay.
Whereas out of school, you've done 3 clinical rotations, you should feel fairly confident in your
You feel
skills.
confident. Yeah.
If you've done acute care, get into acute care. If you're done outpatient, do your outpatient and get your feet wet right away. Once you're there, you're going to realize what you like, what you don't like about the job. But in your resume, now you got a job. You know what I mean? So when you go to apply
Yeah.
to the next job, they go, oh, this guy's already worked, right? And then they may say, hey, why'd you leave this place? And you can tell them. You can say you want to grow more. You can say there was not enough educational content, whatever.
So
So,
be honest, huh?
yeah, I mean, to a degree.
Mhm.
But that's what I think. I think you should right away apply for a job. So I took my
Okay.
first job.
Okay.
And then after 3 months, I was like, you know what? I want to move up. I don't want to, this is not going to get me anywhere. I'm a person that knows where to be. So I was like, this is not what I want to do. I want to work for a bigger company,
Okay.
etc. I went to, again, a smaller company, still working there, 2 smaller companies. And I was like, you know what? No, I want to get to a bigger one. So I've done 1, 2, 3. So the job I'm at right now is probably my fourth job, the
Okay.
fourth one at LifeMark.
And how did you so how did you find those other jobs? Did you
Again,
just
Indeed. Yeah.
Indeed.com?
I
Yeah.
honestly genuinely think that our profession or our schooling in the States prepares us really well.
Yeah.
If you're confident in your skills, like I get quite a bit of interviews.
Mm-hmm.
And during those interviews, this is the one thing I'm gonna vent out. Okay, so people get interviews, right, and they settle for that low paycheck. You know what I mean?
Ooh, let's talk about it.
Right? And I'm
Yes,
like,
let's talk about
I
it.
saw this again, Reddit. I saw this someone on Reddit took a job for I'm just gonna say it, $31 an
That
hour,
is ridiculous.
32 an hour.
That's about 62, 64 thousand
And there's
dollars a year.
nothing wrong with that. Actually, no, not even dollars. Sorry, 35% compensation. So the person took the job in Toronto for 35% compensation. And I was like, what? This
We
is on
broke.
Reddit.
Yeah.
I'm sorry, but like you're giving up 65% of your pay. Um, the thing is, all these grads, new grads come in and they feel like they need to take these low jobs and then they settle for
Yeah.
it. And you're just really destroying the market and you're
And
not valuing yourself enough. Like you're making yourself worthless. I don't know. Anyways,
that's the most important thing, right? Value yourself, value like your education. And if you settle, like you said, if you settle for these low jobs, then it's just
you're just destroying everybody else too. It's not like
yeah.
you're not just you're destroying. You're literally undermining the profession. You're basically saying we're not worth it.
So
I
let's
get a
let's
haircut for $40. The guy makes, you know what I mean? Like, come on.
let's take a calculator. Let's do some quick math right now. Okay.
With a calculator.
So, um, how many patients would you say you see in a day?
See about 10.
Okay, so 10 patients, and and you charge what, 4 units? It doesn't matter.
My personal treatment fee, because I do private care as well on
Uh
the
huh.
side,
Uh huh.
is $80 per session.
It's $80 per session, so 10 people.
That's my
So,
personal
okay,
care.
yeah,
Again, you
and
know, the
typically even
clinics charge different things. That's me.
even
If you came to me
reimbursement.
today, yeah, you know,
Yeah, even in reimbursement with insurance, the average is somewhere around 80, $84. So let's say $80 a day. So 10 times 8, 80, that's 800. And
if
then
you ran your own practice and you got all that money.
no, I mean no. Even insurance
Oh, really?
reimbursement,
Okay.
yeah, is roughly $80. So times 5 days a week, times five, so 800 times five. Now we're up to 4,000. And let's assume that you're working um, 50 weeks or 50 yeah, 50 weeks in a year, like you're taking some time off. So what does that mean? Time, you take 2 weeks off of the year. Do you know how much money you are bringing in a year? 200,000. That's how much money that you are bringing into the company. And you're telling me that there's people out there settling for less than
Yeah.
$50,000 a year? Come on. I
And you
understand
gotta
there's
look,
overhead.
a company is not just using you. There's probably a massage therapist, chiropractor in the same location, right? So,
Yeah,
anyways,
that's how much one person is bringing in a year. I mean, you can check the math. Listen, Payman particular, he sees 10 a day, so 10 times
I mean, there's days I
80.
see 7 or 8, but
Yeah,
yeah,
of
10.
course. This is average. And then I'm counting that you're working 50 weeks in a year. That's 2 weeks off. $200,000. Why are people settling for $50,000? And it's ridiculous.
It's
So
just they're just not confident in their abilities and skills. So I just feel like when someone takes a lower pay, you're undermining the profession by a lot.
so guys, when you go into that interview, do your due diligence. Make sure you go, look online. I know Indeed they have
They
what the
do.
average is.
I
So
mean, the
check,
running fees for physio in Canada, you can look at it. It's like 35 to
yeah,
50 an hour.
and check what the average is for that area and then there's also another website, Job Market Pulse, Updoc Media. That's made by a physical therapist. I think his name is Ben Fung. He he made such a great thing,
What's
and
up, Ben?
yeah, shout out to Ben. I've never met him, never talked to him, but shout out to Ben. um yeah, he made a document, and it's got like the averages in certain areas for physical therapists. Guys, why are we settling for crappy pay? This is ridiculous. You're bringing in roughly $200,000 a year for a company, and you're selling for one fourth of that. Come on. we can be
So
better than
Nico,
that.
you obviously are a physical therapist.
Right.
You got a job differently than I did. So I obviously went through Indeed. And honestly, like, look, getting a job is a numbers game. Submit your
Uh-huh.
resume. Okay, before we get to you, I actually researched the people, like the companies I'm trying to work for. Okay.
Okay.
And when I feel like when somebody interviews, listen, you're interviewing them as much as
Yes,
they're interviewing
you are.
you. Okay.
Yes, that is
I just
that
want
is
to make a
exactly.
great point there.
Yes,
It's like you are trying to you're trying to see if you're a fit for them as much as they're trying to see if you're a fit for the company.
absolutely,
So
absolutely.
so ask questions about billing. Who does your billing, right?
Mm-hmm.
Ask
Ask
questions whether you can check your billing.
productivity. You
Ask
know,
questions on whether, your compensation. Obviously ask questions about safety protocols, ask questions about their infection control, ask questions about like how, if you need information, how can you go about getting it, you
that's
know
right. Productivity. If you have an orientation time, or how long, for do they expect you to ramp up and have a full caseload? Ask about continuing education. That's super important.
I mean,
Um,
they're gonna ask you that for sure. I mean, every
yeah,
interview, what are you gonna do after, or
yeah.
have an idea about like what your future goals are and what you expect to get out of your
Well,
career.
I mean, what their compensation is for continuing at.
Yeah, yeah. If they have some, that'd be
Yeah.
great.
And honestly, guys, the reason why you want to ask these questions is because you want to know about the culture of the company. You know, you want to work in an area, in a place that, that is fun for you.
And I get it. Like honestly, like for example, I did one interview with a clinic. I'm not going to name them, and she was really sweet and everything. The compensation was so low, and I
Mm-hmm.
was like, when I said what I was getting, and she kind of laughed at me. She's like, "Oh, you're so lucky," blah blah blah. And I was like, "Really? That's what's the going rate?" She goes, "Even if I was working, I would only get 40%." I was like, "Well, maybe you got to check your numbers and credentials. I don't know,
I
but
mean, and people are settling for 25%. Ridiculous.
so
Crazy.
I mean, at that point, you might as well open up your own clinic, to be
Yeah.
honest.
It's ridiculous.
But yeah, so make sure you are also interviewing them. Remember what the ultimate goal is when you signed up for this profession: treat patients
Mm-hmm.
effectively to the best of your ability and make them
Mm-hmm.
feel better.
That's
If a
right.
clinic is getting in the way of that, that job is not for you.
Yep.
Okay, that's all I have to say.
The goal is not for the clinic to make money. It's to get the patients better.
Sure they're gonna make money. Healthcare is a business, but remember your number one goal: treat
Yep.
patients. And if you can't treat patients effectively where you're at, for example, if a clinic doesn't have electrical stim, or if they don't buy new electrodes, and you can't use electrical stim, and that's part of your treatment plan, well, guess what, right?
Mm-hmm.
You want all the, and then equipment. Please check the clinic
Oh
first.
yeah. Yeah. Go to the clinic, right? See what kind of equipment they have. You don't want to go to an empty gym and like, all right, use your
Not even a
imagination.
gym. You go in and you're like, oh, it's just a table, right? And you're like, huh? And you just spend doing manual therapy, which there's nothing wrong with, but
I know places that probably do an hour of manual therapy only,
which
and
is fine. That's totally fine. But make sure that you check out the clinic and see what is. I like Google. I look at Google Images. I'll peep
uh-huh.
through all their pictures and stuff like that.
Yeah.
I love reading reviews on the clinics.
Mm-hmm.
If a clinic only has one review, I'm like, okay, I'm out. Or if you see a bunch of like 5-star ratings from like a bunch of random names who just write one word answers,
You know
uh,
it's fake.
it's fake. So,
Yeah.
um,
It's got to be a fit for
it
you
sounds
guys.
like I'm making them like. Uh, it sounds like I'm really, really picky, but I mean, look, man, you're gonna be working there. You're gonna wake
Yeah.
up every morning to go there.
You're
So
spending 40 hours a week in there. You know, you want it to be a fun place. You want it to be enjoyable
pretty
for you.
much. And then honestly, before we get into the first day as a PT, I'll just let Nico kind of talk about how he found his job. I know it's a different process.
Yeah,
So
so being a traveler physical therapist, um,
I got a
you know,
suitcase and my suit in the car, and like, I live in
yeah,
my car.
I've I live in my car basically. I carry all my important stuff in
Anyways,
my car. But yeah, so there's a list basically that I get of available jobs. I talk to a bunch of different recruiters, and then I ask them to send me out to places that interest me. So I'll pick from the list, from the various lists from the different recruiters and different companies, and then I'll ask them, hey, send my stuff, send my resume and everything out to this place, this place, this place, this place, whatever. Um, And so if they like you, if the place likes you, you get a little interview with
So
them.
how do they actually kind of determine whether they like you? Like, do they see a picture of you? Do they see your credentials? What's going on here?
uh
Is it a swipe right option
yeah,
or
it's like Tinder.
okay?
No, so what they do, like I said, I asked the recruiter. So let's say, there's a place in Jacksonville, Florida, and I'm like, oh, I really want to go there. It's an outpatient clinic. So I asked that recruiter, hey, send my resume out to that location. Um, and then, like I said, then that place will take a look at my resume, take a look at like all the information that my recruiter sent, and determine if they like me. If they like me, then they'll interview me. And like Payment says, they probably spend 25% of the time interviewing me, and then 75% of the time is basically me interviewing them because I'm going to be stuck there for 13 weeks. So I want to make sure that it's a good location,
Which
and
is a
then
pretty darn long time if you actually look at it, right? I
yeah, that's
mean,
that's that's 3 months. So I want to make sure the culture is good. I want to make sure that they give good support. I want to make sure that they don't have crazy productivity standards, which we can talk about productivity in a little bit.
I don't want to
Um,
talk about productivity.
and so yeah, I basically just get to know them and see what it's like, and then after the interview, I'll like Payment said, I'll go check out reviews from the clinic or the hospital, and then if I like them and they like me, then they send me an offer, and then yeah.
And then there it
But
is.
guys, I have turned down a lot of jobs because they send crappy offers. Um, well, like we talked about in the beginning, you got to know your worth. That the recruiters will tell you, oh, you're a new graduate,
I
expected
hate
to this
that,
low.
man.
Nope, doesn't matter. I still have the same
What does that
degree.
even mean?
Yeah, nope, sorry.
I'm
I have
sorry, is a new grad not treating the same person in the
yeah.
same amount of time,
uh,
putting same amount of work, if not more than a veteran? Like,
Sure, and for certain, for certain settings, I can understand, like, if they have, for example, if it's my first time doing home health and I've never done home health, and yeah, they have to spend a couple of weeks teaching me and educating me, that's all unbillable time. Certain things I can understand, but if I've known, I'm a if I'm really good at outpatient and I know what I'm doing, like, there's no reason for that. So, I've probably turned down like 4 or 5 job offers before I found my first travel gig. And with every contract, for those of you that are thinking about traveling, for every contract, you know, look at the cost of living in the area. Look at rent.
right? Can you
You
imagine?
know,
You're a child physiotherapist or physical therapist. You're like, oh, I'm gonna make bank, right? You're just traveling. Cost of living hits you, the amount of food, and
yeah,
you're like, wait,
yeah.
what is going
So
on?
look at all that stuff. Look at the GSA. Look at what the reimbursement is for meals and travel and like the stipends. Look at that stuff, and then negotiate your contract. You're allowed to negotiate. I have literally negotiated every single contract that I've worked for a better, a better deal. So just do your due diligence, guys. Just don't settle. Know your worth.
Yeah,
Yeah.
exactly. Just know your worth. Be picky, don't be picky. Like I said, just it's funny because when they were talking about compensation the first time on my first job, I was like, I said this much to this much, and I was stupid. Don't make that. Don't do that. Don't do that.
Mm.
Don't ever give them a range. They'll pick the lower one.
Yes. Yes. Actually, there's some good books out there to read. Um, I listen to a lot of Audible and like audiobooks, and there was this one really good book that I highly recommend if you're negotiating. Um, Man, what was it?
How to make money in
Um,
2021. PT
N-
perspective.
Never Split the Difference by Chris Voss. It's a really great book, or you can listen to it. That's what I did. Never Split the Difference by Chris Voss. Chris Voss. I do recommend it, guys. It gives you good negotiating tools and tricks. Just advocate for yourself.
Okay, well, all right. So you landed that sweet job you wanted, right? And then you get into the workplace first day and you go, you're nervous because you're like, oh, I don't know what to do. I've never met these people. treating
Uh-huh.
clients in a new environment, right?
Uh-huh.
Don't know what the caseload is going to look like. How do we overcome some of those questions or doubts? Am I good enough to be a PT? What if I screw it up and the company fires me and I lose my job?
Oh man.
What do we say to those? How do we deal with that? I've had those questions myself. I've obviously.
Yeah, you
Um,
know what? A couple of people have talked to me recently actually about imposter syndrome, like they have those questions and they're like, "Oh, I'm not good enough, this or that." No, bullshit. I call bullshit. You are good enough. Trust yourself. So just be confident. And even if you're not confident, I know it's cheesy, but fake it till you make it. Guys, you know, you know, even like if something's not your forte, right? Like let's say I'm an orthopedist, like I only do ortho patients. And let's say I see a stroke patient come in. They, I know just a little bit more than the patient, right? Because obviously I'm educated. So just do what you know and then just be confident about it.
and chances are, I mean, regardless of whether you remember everything from your schooling, you remember enough to assess, right? So
Yeah, get
go back to
by.
your base. Honestly, for me personally, I mean, look, not the best clinician, but if I see a case I don't know about, do I know how to manual muscle test? Uh-huh.
Heck yeah.
Do I know my anatomy? Mm-hmm.
Heck yeah.
Do I forget all the special tests? Absolutely.
Absolutely.
um,
Like, come on, Hawkins Kennedy years. Like, what is that
like
again? You know?
right, so it's like, do you know your basics? Do you know your anatomy? Can you kind of come to a clinical reasoning? Can you come to a conclusion based off, so do I don't know everything. There are cases that catch me off surprise. Do I get nervous when treating? Oh heck yeah, it happens.
hmm
But I have good enough of a base knowledge, and I'm sure all of you do, to be able to determine what's going on. And guess what? If you don't get it right the first time, they're gonna come back a second time, or you're gonna try again, right? I mean,
Just treat what you see. At
and
the end of the day,
honestly,
just treat what you see.
man, you know what I loved my second CI, honestly, Concentra, hello. But she was like, payment, like it's not a big deal. Like if your diagnosis is not set in stone. It's a working diagnosis. It changes, it can mold, it can change. You know what I mean?
Mm-hmm.
And that
Mm-hmm.
was that was cool. So don't be nervous about your first day. Get out there and I'm sure you'll do fine. And honestly, my first day, um, was a lot of workplace modules I had to go through on like
Yeah.
sexual abuse and racial equality and different
Mm.
things that anyways, protocols, etc.
And guys, I promise you, everybody's always a little bit nervous. I personally, I'm always having a first day because I'm always moving, and so I have a lot of first days. And every single time, I'm like, I'm always a little bit nervous, but you don't need to show it, right? Just be confident in yourself and be confident in your abilities. Be confident in your education.
Honestly, you're there to treat patients, not to impress your coworkers. So
Yeah,
do what you do best. And the nice thing about clinical experience is you've done it a lot.
yeah,
Right. So
and
it's your job is no different than going to clinicals. You just don't have sometimes the option of asking your CI. But if you have done your fourth clinical successfully, you don't need a
a
um,
CI.
you don't need a CI. You should be all right.
Mm.
So obviously, if you're the people that are hiring you know it's your first day and likely won't overload your caseload with 14 patients unless you're like me and it's your first job and you take it for funsies and all of a sudden you see 14 people in your caseload on day one. um,
That happens to me a lot as a traveler. I'm
and
like, oh, I'm used to it.
I was like, well, my first job, right? I took it, brand
Uh
new
huh.
clinic, just load up 14 clients. I'm like, okay.
Yeah,
But obviously at LifeMark, they're a lot better at it, and they only gave me 5 to start with, and we went up from there. So most of
yeah.
the times they'll be very understanding and building your caseload over
Which,
time.
which is why that's an important question to ask in the interview, guys. Like, what is
Expected
your,
caseload, yeah.
what is the ramp up period? Like, how
And
much
you're
time do they
expected. How many
expect?
people do you expect to see? Yeah, that you make a
Yeah,
great point. How long are assessments? How long are treatment
yeah,
sessions?
that's right.
Um,
How long are typical treatment sessions in that clinic or in the hospital?
yeah.
How long? Do they expect you to get a full caseload in the first week, in the first day?
I mean,
You
damn,
know,
if you do that, you're a trooper.
those
Bless.
are all important questions, and I know it's important to some people, so make sure you ask them, guys.
And yeah, exactly. Like I said, interview them as well, right? The
Mm-hmm.
more you interview them, you realize whether you're fit for them. And then, ultimately you'll be successful in that location. All right.
Okay.
Productivity. You want to
Oh
talk about it
yeah.
or am I running
Oh,
out of here?
productivity. No, let's talk about productivity. I hate productivity. So
you have
that's
out
on it.
you have
That's
outcomes, right? You get tracked.
Yeah, guys. So that okay. So a lot of people that aren't physical therapists, and I explain this to a lot of different professions, that we
All right, I'm out.
our metric on if we are successful for the company or whatever is our productivity. Basically, how many patients we're seeing at a time, or how many units we're charging for our time, basically. Um, so an outpatient, what's a typical productivity payment?
You're
Like a
asking
hundred,
me.
like 100%, more than 100%.
I mean, I don't want to
Uh,
talk about productivity. Stop asking me questions.
okay, I
Two
won't ask you
patients an
questions.
hour.
Yeah,
Like
so
two patients an hour. So,
that's
eh,
200%.
you know,
Yeah, so it
I
varies for
mean, look,
different.
I'm saying two patients an hour, but I know somebody's out there saying no, 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 four.
So it's different. So it's different,
um,
guys, for every setting. It's different for companies, but typically an outpatient, unless you're working in a hospital outpatient, you see one patient an hour. And let's assume that you're working 8 hours and you see 8 patients a day. That's 100% productive. Your whole time is all billable. And then you have outpatient clinics that you see more than one patient an hour, and so then you're going to 100+% productivity. And so
right.
outpatient world, you know, that is common. That is common practice. I've had interviews for like jobs that had like 300, 400, 450% productive. Like they would see like 4 to 5 patients an hour. best
Sure.
believe best believe I turned those down. Like that is
45 patients an hour. You got a Chinese mill running with the electrical stim.
that
Let's
is
go.
that is me. I turned that down so quick. I was like, all right, thank you for this interview. Like I'm you will not
It
be
doesn't
hearing from
matter,
me.
man. How you seen I
Yeah.
mean, honestly, if anybody's doing it out there, you know what? I don't care if they butt heads with me. I don't care who you are
Yeah,
out there. You're seeing
that's not
45 an hour. You're not treating them effectively. I'm
that's
just
not
gonna say
good
it.
treatment. That's my opinion. That's not good treatment. That's
You're
not the
not
best treatment.
talking to them. You're not relating to them. You're not listening to them. You're
Yeah.
going in there saying, "Hi, my name is Bob. I'm gonna do this to you," and they're just doing it.
Damn. RIP all the Bobs out there.
Then we
And
had Bob
then
on the show the other day.
and then you have nursing homes. So nursing homes have a different type of productivity. um they so I've seen jobs that ask for 95% productivity. I've seen jobs for
And that's
like,
1 to 1, right? In the hour, obviously.
so I'll kind
55
of
minutes
explain.
roughly, right?
Yeah, I'll kind of explain that. So 95% productive I've seen, which I turn those down instantly. I've seen as low as like 75, and those are like really good ones. You want places that have lower productivity because they're better for you. It's a better culture. So what does 95% productivity mean? That means out of the 8 hours, 95% of that has to be billable treatment, which means um if you have a patient and they're going to the bathroom, that's not therapy. You can't bill for that. If you need a bathroom break, that's not therapy. You can't
Wait,
bill
you
for
don't get
that.
lunch at 95%?
No, that lunch doesn't count. Like you're not including
Oh, okay.
lunch. That I'm talking about an 8-hour workday, not
So they
including lunch.
want you to bill 95% of the time
Eight
that you're with them.
that you're yeah, but like if a patient needs to go to the bathroom, is that therapeutic? So you can't bill for that when you're
Sure, it's
document
called gait training, man, and sit to
when you're
stand. Come on.
not when they're pooping, not when they're pooping for like 20 minutes.
Core
um
activation.
and just things like that, like a lot of the stuff that happens in nursing homes, getting the patient ready, transporting them in a wheelchair from their room to the gym, that's all technically not therapeutic things, so you should not be billing therapeutic therapy for that. So what is 95%? So can you imagine only 5% of the time is unproductive? I don't think you can do that reasonably. That's including your bathroom breaks. So if you have to poop, forget about it. You lost you lost at
So what
95% productive.
happens if you don't meet this productivity
Well, they
number?
you know they get mad at you.
Yeah, and then what, Nico? Do they just
Yeah,
fire
and
you?
then they can it can be a basis for firing. So when I worked in a nursing home, my productivity was 83%. So I ended up staying in that contract for a while. You know how many times I hit 83%? Like 3. 3 days
Out of
I
what, 3 months?
no, out of 8 months. I stayed there for 8 months and I hit
And you hit it.
83% productive like 3 times. Most of my time I was hanging out around like 70. And because like, I know um people bill for when they're transporting patient when they shouldn't be,
And
and
I think they're doing that just so because of the pressure of the productivity,
yeah, exactly. So
unfortunately.
and that's why I don't love nursing homes, because there is a lot of fraudulent billing going on. And I'm not saying all nursing homes are like that. Like there are some great ones, and then there are some nursing homes where like, they bring the patient to you, and that makes it easier because then the patient is already ready. But
Yeah.
if you need to go get that patient yourself and do all that kind of stuff, it's pretty hard to get productive with
So if
them.
you go to nursing, if you go to the patient's bedroom, the time it takes for you to go to the bedroom, bring them to the clinic is not actually billable per se.
I mean, unless you are doing something that you would consider therapeutic, and is me wheeling them to a wheelchair down the hall therapy? I don't think so. So I don't bill for it,
Yeah,
and
that
then
makes
you will
sense.
get people that will bill for it,
You could
so
theoretically say getting them up from the bed to your chair is almost like a
yeah,
transfer
sure.
training per se. I don't
Sure.
know.
And that takes what, like a few
In
seconds.
minutes, I
Yeah.
suppose.
But what about when you're rolling them down in the wheelchair, Just, little things like that. And if they have to go to the bathroom, they have to pee, sure, transferring them to the toilet is absolutely therapeutic. But then what about when you leave them and they're just
Yeah.
doing their business? So things like that.
So do you kind of take away from their time when they have to go to the bathroom, or you just start the timer from when you see them?
No, I start the timer
When you see
like,
them, you get them
yeah,
back
when
to the clinic and you're doing your things, right?
yeah, yeah, yeah.
Yeah.
So, I count whatever's therapeutic. And then did my manager, mention to me like, hey, like your productivity is kind of lacking, and
Lower than 83.
yeah. And I'm like, I'm sorry. And my productivity is at 72, but like, what do you want me to do? And then especially like donning and doffing PPE, like you gotta, put the gown on and everything, take
Yeah,
that
man. There's a
out.
lot of unrealistic expectations out there.
Exactly.
Honestly, like we could go on and on, which is why I'm not talking about
Yeah.
productivity. I don't want to
Yeah.
talk about it. It's one of those
And then
things.
productivity in the hospital is a little bit different. I like the productivity in the hospital. It's not, you just got to, that's pretty nice. So yeah, I mean, different settings have different productivity standards. See what's comfortable for you. Protect your
And I
license.
assure you, there's always a job for you out there. Just keep
Yeah.
looking.
Just protect your license. Don't succumb to poor productivity standards. Like I said, I have a friend who's working in Chicago. He's working in a place, and he just he's miserable. He's miserable. The pay is good, but he's miserable because his productivity is like 300%, and it just burns you out.
Anyways, so that's productivity. I think we touched on everything we wanted to touch on today. Oh, how to manage time at work. Have good time management skills. I'm kidding. Oh man, how do I manage my time at work? It's nice though. I don't know if you don't work outpatient right now, so I get my daily schedule. Like my schedule's up. So the day before, I go through my patient list, and I already have a plan for them before they even get in.
And
Um,
then you're also willing to change that plan up,
oh yeah, I
right?
mean it's not like I
Right.
walk in there with my notepad and but when you see a lot of people in your head, you're like, oh okay, I did this with them. I'm expecting this to happen. If it doesn't happen, you change it up. But my job is nice. I get to see that beforehand, so I can
Mhm.
see who's coming in advance. If I
Uh-huh.
have to do any research, Gloria, if you're out there, you just kind of do your research before you get to work. um, and so on and so forth. Like protocols sometimes, like I'll read up on the protocols just to make sure they're in line with what's going on for surgeries. Um, but at work, it's pretty easy to manage because it's 30-minute timelines. Man, there's times I go to my lunch. It's just, it is what it is.
And let's talk about this because I know this is where you and me disagree. In my opinion, boys and girls, um, don't if if let's say you're an hourly person,
And you don't get paid
don't
for lunch like this guy.
don't don't take work outside. Don't do notes outside. Don't take them home. I know Payment does it.
A lot.
Yeah, don't do it. Don't work through your lunch.
I just want to show
Take
you what this folder is.
and the reason, guys, is because it's setting an unrealistic expectation.
No, but I have
And
a good reason for doing notes outside. And the only reason I do notes outside is because I'm not bashing on the company. The laptops over there are slow AF.
well, it
Okay.
sounds like you need to tell them to step it up and get
Like we're
better
using
computers.
i5s and we're in the i9
Yeah,
generation.
yeah, you got the new i9. Yeah, you need to tell them like, hey, listen, this needs to change because
Nah,
right
it's all
now I'm
good.
spending an hour, 2 hours at home doing notes.
Honestly,
And
I'm not a big laptop guy. I prefer desktop. So when I'm home, I can do like a 2 hour worth of notes in like 15 to 20 minutes, if anything. No, I'm just
Mhm.
exaggerating. It'll take me a solid like hour. But um yeah, I take my notes home. I know a couple of PTs do. There are some PTs that refuse to. They will
That's
not.
me.
It'll
That's
pile
me.
up. It'll pile up and they'll do them at some point in their life as they go on about it. um or they do it during work time if they can. I can't squeeze it
Yeah.
in. It's not going to happen. I spend a lot of my time. You pick and choose what PT you want to be. I spend a lot of my time talking to patients. So, you know, even when they're on the Easton machine, sometimes I'm just talking to them, making it an experience for them. But
Yeah, customer service, guys. That's one of the goals that
you guys do.
one of the things I learned.
You
Customer
know, it's
service
funny
important.
because what was I going to say? You mentioned something and I just can't. Oh, you know how we were talking about value?
Uh-huh.
So you know how like you'll go to a doctor, right? And then you talk to your doctor or a physiotherapist, doesn't matter, any healthcare professional, and they give you advice without ever touching you. It's not a bad thing. I'm just saying in a good way. Patient education, right?
Mm-hmm.
And then patient walks out and probably thinks, "Oh man, I just spent like $90 on just information."
Mm-hmm.
But man, that information is valuable. I had a
It's
patient today that was
super
so
valuable.
grateful. Dude, shoulder injury, right? He's been getting treated. I thought it was tendonitis at first, and I was like, blah blah. Anyways, long story short, he had a little bit of impingement going on for
Mm-hmm.
whatever reason. I think he had a little bit of forward shoulder roll. Anyways, we talked about it. I made literally my last session with him was just making recommendation on his exercises that he was doing. Just
Uh-huh.
reviewed it with him. Maybe did 2 minutes manual, and that was all the time I had.
Yeah.
Comes in
Education is
today, he was
important.
so happy. He's like, "I'm pain free." I was like, sometimes you don't.
It's
Yeah.
all about education, man. I had a patient today or yesterday. He's had COPD for 40 years. And I asked him, hey, like, what do you know about COPD? He's like, honestly, it's just something that I know I have. And I was like, so I explained to him, I
Let
was
me
like,
turn this
listen,
phone.
hashtag sponsor us. So I was telling him, I was like, listen, like I spent time educating because nobody ever educated him on what COPD is and how, it's important to get that air out. And no one ever did that. He was like, oh, I'm like, I didn't know, like my problem was that I can't get air out. And so he's like, oh, I need more oxygen. I need more oxygen. I need more oxygen. But like, no, that's not the problem.
Yeah, you have
So
difficulty
guys,
getting air out.
education is so important. So important. What seems trivial to you can just be a game changer for
And that's the
patients.
thing, man. It's like, when like you first study something, like I think this is a concept where like if you're in school and you look at like 40 slides, like it's daunting, let's say.
Uh-huh.
But once you learn it, it's like it feels like just one slide, right?
Yeah.
And that's the thing. You've spent the time and you've learned it. Whatever you think you know, that maybe as simple as just bending your head down, that might make them feel better. It
Yeah.
seems simple, but hey, you came to that conclusion. And that's what
Mm-hmm.
I mean. Don't sell yourself short.
Yeah, and don't just tell them to do it. Explain why. Explain the reasoning because
Yeah.
that then they'll understand. Oh, okay, that makes sense now. Why I need to do that.
Pretty much, honestly. I don't go through all like the jargon. I said it.
It's
But
been,
yeah, anyways, I think that was good for episode 6.
yeah, guys. Thanks for tuning in.
Thanks for tuning in. We're happy that you guys are listening. I do apologize for the 2 week delay on this one.
Hiatus.
But life is a thing, and yeah, we'll catch you on the next one.
Keep them questions coming.
Keep them coming. We'll
Oh,
always cover
give us 5 stars on
it.
Apple Podcast and on Spotify, guys. If you're watching this on YouTube, like and
Pepsi
subscribe.
sponsor.
Like, somebody sponsor us, please.
All right, guys, stay
All
safe
right.
out there. Have a good one.